In this third video of our part 3 series on testosterone in women, we're going to talk more about treatment options and how we can improve testosterone levels. If you recall, and if you haven't seen already, please check out part 1 and part 2, in which we discussed the causes of low testosterone, the symptoms of low testosterone, what is hypoactive sexual desire disorder, and in part 2, we discussed all around blood work and what we can do and how we should look at blood work. So this part 3 is now taking into consideration someone who comes to you with low testosterone symptoms and low testosterone levels. What can be done for that? And if you're struggling with this, then this is a really important video for you. My name is Dr. Omar Akhter, and I'm a board-certified internist with a private practice in Austin, Texas, that approaches chronic disease in a holistic manner, and with a particular focus on hormone optimization. So this very important topic of testosterone, low testosterone in women. Now, if you recall, we talked about how low testosterone symptoms, just a quick recap, is with a decreased energy, decreased muscle mass, low libido, and any other sexual related issues. That all represents or can represent low testosterone. We will look at blood levels to check that, blood levels being the best, and it needs an LC-MS assay. That's a specific type of blood test that can be done at any of the common labs. And we talked about levels, and again, I refer you to the previous video to go into the specifics of the levels. But now we're going to talk about treatment options. And so the number one thing is it's important for us to understand the underlying cause. That's important to identify in starting the treatment, which means that is the low testosterone caused by oral contraceptive pills? Well, that might be something that needs to be adjusted. Or is it caused by the foundational issues like poor diet, stress, lack of exercise, poor sleep, all of which do deplete testosterone over time? And lastly, could it be due to age? So women in menopause are going to tend to have much less testosterone, in which case there isn't really an underlying cause that can be fixed. It's more that perhaps testosterone replacement is necessary. So the cause is important. Now, once you do have the cause, it's important to note that there are several different options available for testosterone supplementation, let's say. And so testosterone, generally speaking, there's going to be a transdermal way. Now, transdermal means through the skin, so that includes patches, creams, and gels. There is going to be testosterone taken sublingually, so under the tongue. That is a way of getting it orally, but you do pass the liver and the gut in that way. Testosterone is very poorly absorbed in the gut, and so that's why it's not taken in that form. And then there are an intramuscular injection that a lot of times men get. And then there are also pellets, pellets being these subdermal, or underneath the skin, you have these insertions that many people are familiar with that then slowly give testosterone over time. So these are the different formulations that are present. What's important to understand is that there is really no FDA approved treatment option for women. And there are certain FDA approved drugs that can treat hypoactive sexual desire disorder, which is that one little narrow definition of what we're talking about, but that doesn't apply more broadly to women in general who might have low energy and just generally low testosterone symptoms. So all that to suggest that testosterone, when it is used in women, is used in an off-label manner, and that's completely fine. That can be done, but unfortunately, the medical world and the conventional medical system is fairly late to realize the excellent data that we have on testosterone in women and the importance of it. And so there are various political, economic reasons for this, and just a general lack of really looking at the evidence, in my opinion, on that. And that is more of a that occurs broadly with hormones in general. So That is just kind of where I'm coming from as far as the treatment options go. Now the question becomes, how do you pick the best option for you? And in the past, the FDA has said that, for example, androgel, which is FDA approved in men, you would take that and you would just cut a tenth of it and then basically use that. And again, suggestions like this are being said to avoid things like compounding pharmacies and so on, because there's a lot of internal politics and economics that plays a part in this. So but that aside, that's a separate issue. But I think the main thing that I want to stress and emphasize is that compounded creams in women should be considered, because they can oftentimes get a much more sustained level and not have the kind of levels that shoot up with pellets and injections, which we don't want. For men, injections is a much more appropriate form of testosterone replacement. In women, in my opinion, transdermal and cream form is the best. So you'll get the cream in a compounding pharmacy. And again, one of the critiques about compounding pharmacies is that they're not well regulated or things like that. But the truth is that compounding pharmacies are actually regulated by the State Board of Pharmacy, and they have very high standards to which they adhere to. So I think that if you find a good compounding pharmacy and a good pharmacist, I think that they're very valuable and they do things very well. So we usually will start at a very low dose, so that could be 0.5 milligram for women, sometimes 1 milligram. So it just depends on the build of a woman, what the extent of her needs are. And so we start slowly and we titrate upwards. And when we titrate upwards, we are really looking to get to the point of optimization, which means to get to a point that you can get all the benefit of testosterone, but not have any negative side effects. And the side effects with testosterone that can happen if the levels are too high are oily skin, acne and skin breakouts. Okay, a lot of times there can be like mood disturbances. If it's too much, you can have those rage type of episodes. And so primarily it's around skin and mood, and then you can have some excess hair growth in places that are not wanted. So all those type of androgen type of symptoms. So that is a little brief on testosterone supplementation in women, when it should be used, what form it should be used, what dosage. And if you have any questions, please let us know in the comments below. But I hope that this 3-part series was very beneficial from the point of view of trying to get a grasp of this very important but underappreciated topic in the world of medicine. So hopefully we can build on this and get women the help that they need as it pertains to testosterone. Thank you.